So good morning everyone, my name is Irish Dalion from BSN 1 and today I will be performing hand hygiene. So before we perform hand hygiene, same as the assessing blood pressure, we should know first the ADPI process, which include assessment, diagnosis, planning, implementation, and evaluation. So next is assessment. So the purpose of performing hand hygiene is it is a way of cleaning one's hands to reduce the potential pathogens or harmful microorganisms on the hands. Next is hand hygiene is also considered as the primary measurements that can reduce the risk of transmitting infection among patients and healthcare personnel. So next is the World Health Organization. The World Health Organization has developed an evidence-based measurements of hand hygiene, which we called 5 moments, which refers to washing hands before touching the patients, before performing clean and antiseptic techniques, after potentially exposure to body fluids, and after touching the patients, and after touching the patient's surroundings. So next is to determine the client's presence factor, increasing susceptibility to a infection, use common superimmunostative to a medication, and recent diagnostic procedure or techniques that permeated to the skin or body cavity. And lastly, signs and symptoms indicating to an infection. So there are two major types of skin reaction associated with hand hygiene. First is irritant contact dermatitis, which includes symptoms that may vary to mild to debilitating. Includes dryness, irritation, itching, and even cracking and bleeding. So next is systemic indication. The hands should be washed with water, visibly dirt or soiled with blood or bodily fluids, or after using the toilet. Hand washing is a preferred technique of hand hygiene when exposure to potential spores forming pathogens when it is suspected or proven. So next is planning. So in planning, we determine the location of the warm water. So the equipment needed in here is paper towel, warm running water, and soap. So next is implementation. So for the preparation, assess the hands. Nails should be kept short so that they are less likely to harbor microorganisms, because long nails are hard to clean. Next is remove all jewelry. Some nurses with watch, they prefer to slide their watch above their elbow, or some pin their watches to their uniform. So next is the caregiver should cleanse her hands adequately to prevent the microorganism transient flora or soil from the skin. Jewelries can lodge the settings in the jewelries or under the rings. Remove facilities cleansing hands and arms. Next is check the skin breaks from the hands, such as hangnails or cut. Next, nurse who has an open spores should change their work assignment or wear gloves for protection. Next is stand in front of the sink, keeping hands and uniform away from the surface of the sink. And also avoid reaching the sink and touching the edge to prevent contamination. So if you are performing where the client can observe you, identify yourself and verify your client identity using agency protocol. And also explain what you are going to do, why it is necessary, and how she or he can participate. After that, explain the result that can be used in planning for further care or treatments. So the next is procedure. So turn on the water and adjust the flow. So there are 4 common types of faucet controls. First is hand-operated candles. Second is knee levers. Move this with your knee to regulate the flow and temperature. Next is foot pedals. Press this with your foot to regulate the flow and the temperature. And lastly is the elbow controls. Use your elbows instead of your hands. Be careful in splashing the water to your uniform, because splashing water to your uniform may result as contamination as moisture breeds microorganisms. So adjust the flow so that the water becomes warm. Warm water can remove the protective soils from your skin and also to remove the microorganism effectively. Hot water can open the pores in the skin. That can cause dryness and chapping on the skin by removing oils. While the cold water does not make soap soft and ineffective in removing microorganisms. Hold the hands to the elbow so that the water flows from the elbow to the fingertips. The water should run from at least contaminated to the most contaminated. So the hands is most contaminated than the lower arms. So running water can remove the microorganism and dirt on the sink. So if you are using liquid soap, apply 2 to 4 ml. Then if it is bar soap, rub it firmly between your hands to remove the outer layer. Because the outer layer of the bar soap contains microorganisms and it should be washed first before using it. Next is lather the arms and arms. And then apply 1 to 2 pumps of liquid soap to your hands. Enough soap will lather the palm, back of the hands, fingers, and thumbs. Next is I will going to rub my palm together. Ensure that all the surface is covered with soap. Using friction to remove debris or oil. Next is rub in between fingers and around the fingers. Next is rub on each hand of the back of the palm. And next is press and rub the fingertips or fingernails of the opposite hand. So the clean tips, fingertips, and underneath nail beds. Next is rub the thumb of a hand in a circle with the opposite palm. So up to the thumb, make sure also to wash your wrist. So after that, rinse your hands with water. Make sure that your fingertips is pointing downward where the water flows. Rinsing this way, allow the hands and the drains downward. Next is I will be getting a clean paper towel, but be careful to prevent a skin irritation. So after that, I'm going to get another one that I will be using and turning off the faucet. After that, I will going to throw to the garbage. So using paper towels will prevent the contaminated of touching hands in the faucet or other things. So my hands are now clean. For the evaluation, there is no traditional evaluation of the effectiveness of the individual's nurse hand washing practice. Thank you. Good morning, sunshine. My name is Irish De Leon from BSN 1. Isn't it a beautiful day today? That's why today I will be applying and removing personal protective equipment such as masks, gloves, eyewear, and gowns. So, always remember that we always need the ADPI process when we perform different techniques and procedures in nursing. So, the purpose of PPE is to protect the healthcare workers and clients to the transmission of potentially ineffective materials. Basically, to reduce the risk of infectious agents. And PPE must be used appropriately. So, we can now proceed to the ADPI process. First is assessment. Consider which activity is required while the nurse is in the client's room and to determine the equipment needed. Next is planning, which include application and removal of PPE can be a time-consuming. So prioritize care and arrange to personnel to care to your other clients is indicated. Determine which supplies is present to the client's room and which must be brought to the client's room. And consider special handling and removal of any specimens or other materials from the room. Use of PPE is identical for all healthcare providers, and clients who requires a PPE may be assigned to AP. So next is the equipment needed in here is eyewear, face mask, gloves, and gown. Next is implementation. So the first part of implementation is preparation. Remove or secure all loose items such as name tags or jewelry. So next is performance. Prior performing this procedure, I will first identify myself and verify my client's identity using agency protocol. After that, I will going to explain what I am going to do, why it is necessary, and how to participate. So next is I will going to perform hand hygiene alcohol-based rub. So after that, I am going now to apply my clean gown. But before that, I am going to place the camera right so that I can show you how to apply a clean gown. So now I am going to pick up my clean gown and I will allow it to unfold in front of you without touching any soil body substance. After that, I am going to slide my arms and hands through the sleeves. And I will fasten the ties in my neck so that my gown keeps on place. Overlap the gown as much as possible and fasten the waist ties or belt. Overlapping covers the uniform at the back, and waist ties keep the gown away from falling to your body, which can cause an inadvertent soiling of the uniform. So next, I am going to apply my face mask. And I will locate the top of the edge. So basically, this is the top of the edge. And masks usually have a narrow metal strips. And now I am going to hold my mask at the two strips or loops. And then I will going to place the edge of my mask over the bridge of my nose. And place the ties of my mask to my ears. So, if glasses are worn, fit the upper edge of the mask under your glasses. With the edge under your glasses, clouding is less likely to occur. To secure the lower edge of the mask under the chin, to be effective, mask should cover both nose and mouth because air moves in and out of both. So next, if your mask have a metal strip, adjust this firmly over the bridge of your nose. Secure fit prevents both escape and inhalation of microorganisms around the edges of the mask and the fogging of the glasses. Wear mask only once and do not wear your mask any longer than the manufacturer's recommended or when it becomes wet. The mask should use only because it becomes ineffective when moist exhaled breath.
Do not leave a used face mask hanging around the neck. The practice guidelines provide further instruction on using a face mask.
Next is apply a protective eyewear if it is not combined with the mask. So if you are wearing a gown, pull up the gloves to cover the cuffs of the gown and pull up the gloves to cover the wrist. So next, we can proceed now to the doffing of the PPE. So to remove the soiled PPE, I'm going to remove my gloves first since they are the most soiled. But if you are wearing a gown that has tie in front, remove the tie first before removing the gloves. But since I do not have a gown that has tie in front, I am going now to remove my gloves. Remove the first glove by grasping it on its palmar surface, taking care to touch only glove to glove. This keeps soiled parts of the used glove from touching your skin, wrist, or hand. So pull the first glove completely by interverting or rolling inside out. Continue to hold the inverted removed gloves by your fingers of the remaining gloved hand. So place the first two fingers inside the cuff of the second glove. So touching the outside of the second soiled glove with your bare hands is avoided. Pull the second glove off to the fingers by turning it inside out. Pull the first glove inside the second glove. Using bare hands, continue to remove the gloves which are now inside out. So now I will going to dispose them in a refuse container. So after that, I will going to perform hand hygiene alcohol-based rub because contact with microorganisms may occur in removing PPE. Next is I am going to remove my eyewear and dispose properly in the place appropriately for acceptable of cleaning. Next is remove the gown when preparing to leave the room. Avoid touching the soiled part on the outside of your gown if possible. The top part of your gown may be soiled. For example, if you are holding an infant with respiratory infection, grasp the gown along inside the neck and pull down to your shoulders. Do not shake your gowns. So after that, roll up the gown with shoulder part inside. And discard this in appropriate container. Removes mask at the doorway to the client's room. So if you are using a respirator mask, remove it after leaving the room or closing the door. So if you are using a string mask, untie first the lower strings of the mask. So now I am going to remove my mask from my face. So if side loops are present, lift up the side loops away from your ears and face. So do not touch the front of the mask. So the front of the mask at which nurse is breathing has been contaminated. So now I'm going to dispose my mask in a refuse container. So after that, I will going to perform hand hygiene alcohol-based rub. So for the evaluation, conduct a follow-up indicated during your care to your client. So if there has been any failure to the equipment and to the exposure of the potentially ineffective materials is suspected, follow the procedure in practice guidelines. Ensure that an adequate equipment supply is available for healthcare providers. Thank you.